What started as an integral back and knee pain rehabilitation clinic started translating or moving into what it is today, a longevity school, which is a place that is where seniors learn the biology of their aging process, and they design, or we design with them, their longevity plan, a strategy to make sure that they reach their 90s in their top 19th percentile.
Are you an entrepreneur looking to disrupt the healthcare industry? Do you want to stay on top of the latest innovations and trends in the world of health and wellness? My name is Gonzalo, and I welcome you to this brand new podcast titled Healthcare Disruptors, that explores the intersection of entrepreneurship and healthcare. In this series, we will be talking with entrepreneurs, experts, and CEOs who are revolutionizing the healthcare sector through cutting-edge technologies products, digital services, and much more. Healthcare Disruptors is brought to you by the EIT Health Innovators community, a network of professionals who are passionate about revolutionizing the healthcare industry. Join the community today. Welcome everyone to the first episode of Healthcare Disruptors, a podcast with the EIT Health Community Innovators. Today our guest is Clara Fernandez, co-founder of Rosita Longevity, and we are to have her here because she accepted the invitation just in my very first mail. So thank you, Clara, for being here, and welcome to this new podcast.
Thank you very much, Gonzalo. It's a pleasure to be with you this morning.
Okay, let me introduce you to the audience. I read you over LinkedIn and I found you, and later you can make your own introduction to the audience. Well, Clara Fernandez is the founder of Rosita Longevity, and her life mission is to help as much as possible in increasing healthy life expectancy, one of the biggest challenges of the 21st century. She is running 3 projects in the field of longevity. One of them is Rx-Longevty, so it is Rosita Longevity, a longevity coach app that helps seniors plan and execute their longevity plan online, and we'll introduce the company a little bit later. Also, she's involved in the longevity school. She's the founder of the biggest longevity school for seniors in Europe, with over 15,000 seniors annually in a balneario in Spain, and they work with the Spanish government, Balneario Cofrentes, and she's also in the human lab for longevity. This is inside the longevity school, and they work on prospective studies with healthy seniors. Is going to become into a longevity bank. She's interested in many things, but one of the things that sounds me the most was that she offers help in female and rural entrepreneurship and biohacking tips. And the introduction of the company of Rosita Longevity is that on a mission to extend the healthy life expectancy by helping people reduce the risk of preventable chronic degenerative disease. They talk about frailty that happens in the 80s and the 90s and the 90s. But they think that the process starts much earlier. So, and they can reverse everything if you pick up early with the help of their longevity plan and their longevity coaches. They have been built everything from Valencia, but now they are in the USA. So what to me means Clara and means Rosita Longevity. If you want to add whatever or to make your own intro to the audience, so go ahead.
Well, I've been passionate for the last 15 years about the process of aging, and I believe that aging is the main cause of unnecessary suffering in the world because it affects everyone in humanity. And one of the things that is most exciting is that science already knows many things to make sure that people can age better. By aging better, what I mean is that today, science cannot delay death, but they can delay a lot of the age-related diseases. And I think most of the people that work in age-related diseases or in healthcare have seen the graph where people live an average of 85 years, but today only 65 years are lived with good health. So what it's called is that today our life expectancy is 85 years, but our healthy life expectancy is 65 years. The fact that the last 20 years of humanity or humans today are lived with a pain or a disease that could be prevented or reverted is I think a life mission for our generation. So I think for most of the scientists and biotech engineers of our generation. And what I'd like to say is that I want to be I want to actively participate in being one of the best solutions or being one of the solutions to help people age better, reduce the gap between life expectancy and healthy life expectancy, or make sure that we live more years with more healthy years.
Well, it sounds really good and really interesting. I mean, and also, do you want to introduce yourself to the audience? Do you want to tell the audience a little bit more about what I told them, or
yes,
so that is?
I can tell them a little bit of the origin of how everything happened, which I think is very important to understand my perspective, my experience in how the project of today, the main product, Rosita Longevity, is growing, right? So my origin is that my parents are physicians, and they had a clinic in the mountains that was aimed for back and knee pain rehabilitation. We were focused on seniors, people from 65 to 80 that had chronic back pain. Chronic back pain is one of the biggest diseases that are age-related because it's a natural degeneration of your body that whereby your joints lose the cartilage and basically they wear or tear out, and the friction starts generating pain. The main significance if we compare them with other age-related diseases is that this one hurts. So most of the age-related diseases have a treatment that when it's in place, you can sort of like silence the symptoms. And most of the people live many years with that pathology around, with having that degeneration around, but without the suffering, which is great to not suffer, but also bad in the sense that people are not aware about the size and the importance of what's happening to their body. With chronic pain, people are suffering daily and they're daily seeking for solutions. So it's very easy to appeal to that population because they are already looking for something to reduce their pain. So this clinic had been working for 30 years in the back and knee pain rehabilitation sphere with water because it's a thermal resort. So we do rehabilitation instead of the water. And when I started working in the company around 12 years ago, I started introducing the concept of education. My idea was to empower the patient to understand what was happening to their body as they age, why they were having the symptoms, and also to understand that their next 20 years could be completely different depending on what they did, depending on their strategy they followed. There was no one linear path to how their body was going to degenerate. There was many factors going to affect them. And so I started introducing education. I realized that people knew nothing about their chronic pathology. They knew nothing about their own impact in their health. And I started introducing different specialists. So we started talking about nutrition and inflammation and how that played into the role. How, for example, one of the most amazing things is that there's, on average, most of the seniors are not aware that them being obese affects their knee and their knee pain. And that's a very physical position. So if your knee is weak, the more it holds, the faster it's going to degenerate. That's a very simple correlation. And most of the people are not aware that if they reduce weight, their knee problem is going to be reduced because they're going to physically enforce less weight on that knee. So that's a very simple example of things people were not aware, right? So I started introducing nutrition, inflammation. I started introducing more doctors talking about pain, what the connections between pain and the nerves, and how people could feel pain in different ways. And it was not specifically correlated to degeneration, but to other features. So also psychologists, nurses, physical therapists, trainers, a wide spectrum of teachers. And I started discovering that people were not aware about their aging process and did not have any sorts of plan. So what started as an integral back and knee pain rehabilitation clinic started translating or moving into what it is today, a longevity school, which is a place that is where seniors learn the biology of their aging process, and they design or redesign with them their longevity plan, a strategy to make sure that they reach their 90s in their top 19th percentile. So in healthcare, and especially when you're older already, you cannot aim to go for like a pass or like a 5. You need to aim for a 9 or like a 10 in your health status, because a 5 means that on average, when you're 65 years, you already have a pain or a disease that is affecting you. That's the average, right? So the average is that healthy life expectancy is 65 years. And so we have to sort of like change our mindset and start thinking that if we want to live healthy, we need to do the maximum amount of things that we can do with our health. You cannot just like leave yourself to Mother Nature, because Mother Nature takes you to your healthy lifespan is only 65 years, right? So I started creating this concept of the longevity school, which is like a camp for seniors. They come every year and they advance in their longevity strategy, which is a healthy aging program. We have a very comprehensive methodology that includes diagnosis, treatments, and education. And basically, the person comes every day. The first day they come that year, they sort of get like their battery of diagnosis updated, and they get like a schedule for the next 10 days, because they spent with us over 10 days. And they have over 4 hours of treatments in the morning that are related to their current chronic pathologies, and 4 hours of education in the afternoon, which are combined, where we're combining things that we think they need to learn with things that they have to make a specific focus. It's a focus subject because it's their already current risk or current pathology. And so this combines sort of like a personalized plan where it's not uniquely personalized medicine. It's actually what we call cohort-based personalization, because we're actually grouping people into a combination of healthcare status and comorbidities. And that creates very unique cohorts by which we have this specific program. But it's this cohorts that makes it efficient in terms of economic healthcare efficiency to coach together, right? And so we, over the last 10, 12 years, I created this combined methodology of scientific methodology and behavioral methodology, because you need to understand that one of the most important things in healthcare is not to keep investigating on what makes a health change, on what actually makes a health impact, but to start investigating on what actually translates into the patient population. And that requires a lot of like behavioral science. So that's a little bit what I've been doing over the 10, 12 last years. And introducing there the concept of the human lab is that inside of the school, we have an area where we investigate and participate in different investigations all over Europe, related to like prospective studies in aging or like specific one data point studies. And that enables us also to have access to the latest technologies, the latest publications, and also provide our patients access to the latest treatments for most of the time free in the context of this clinical studies. And so that's where the human lab has been growing over the last years. And what actually happened, or the way Rosita was born, was that 2 years ago we were deciding how could we actually scale the concept of the longevity school to reach millions of seniors that could benefit from both our medical and our behavioral type background, the things that we've discovered over the last years and the methodology we've created. And the way we decided to do that was to scale the project's creating a longevity coach, translating everything that we already knew was effective from the school into a mobile app where seniors could actually access from their phone their longevity plan and have access to their longevity coach, leveraging the cohort-based methodology that we have in the clinic, and which has proven a lot of success over the last years. And that's how the longevity app started. The longevity coach app started. Rosita Longevity.
To be honest, I mean, you had to be our first guest because you are a disruptor in the business of your family, and that's everything that you have done so far. And I see I see your passion in your eyes and also in your message. So I mean, it's always good listening to people like you. But my question is, and we are talking about healthcare disruptors, what do you mean for you being a healthcare disruptor as you are?
What does it mean? You mean?
Yes. What does it mean with you?
I mean, for me, I consider I'm doing something that's necessary. So the fact that the general population lives 20 years with a pain or a disease that could be prevented, and the current healthcare system doesn't have the adequate mechanisms to cope with that, just means that someone needed to do something here. And so I don't see myself as a disruptor. I see myself as actually like doing something that is needed, and not just like going against the status quo. Although in many terms, every day I'm facing the complications of doing something different, right? I can tell you many things.
Yeah.
For example, one of the things that is complicated today is that both in Europe and in the US, and I can tell you like tons of differences among like the different healthcare systems, but it's the fact that healthcare is very oriented to a pathology. So you treat cardiovascular diseases, you treat cancer, you treat Alzheimer, and people are not, doctors are completely aware that the highest correlation to all those diseases is age. So just by aging, you have the highest risk of getting those diseases. But yet, when you're talking about treatment, everyone wants to like focus only on one specific disease. So when you talk about like health longevity, everyone thinks, although they understand that that's the way to go, everyone thinks it's still a very utopian future. So we should still be thinking about this marginal treatment that is marginally going to affect this parameter in your cardiovascular disease and not going to like the root cause. So I still have, every day I have the conversation with like different doctors, and they're like, what you do is what ought to be done, but I don't have budget for that. I only have budget to like this pharma drug that's here. So I'm with you, yeah, but I is here for this marginal pharma disease. So I think that the disruption is having to cope today with the fact that you're doing what ought to be done, while you have to sort of like camouflage yourself into one of the different areas that can be paid for without losing your DNA, right? Without losing the fact that you're not doing cardiovascular disease treatment. You're doing age-related diseases and the aging process, right? So disruption, I think, lies mostly in there, how to like be able to manage what the future or like the reality needs while being alive and getting funded through the current mechanism, right? So it's something that I think that's one of the biggest dilemmas, and it's the biggest challenges, and how to stay there, moving towards the end goal you want to go without dying or losing your DNA, right?
Yeah, and I mean, I love your answer because at the end is leading the future. You are leading the future with what you do now. You don't think about it. You think about it obviously, but you make things happen. And also you talk that you are now in the USA, but you were built in Valencia. How is building a company in Valencia? Valencia is in the east side of Spain. It's one of the biggest cities in Spain. Uh, but how is building a company from Valencia to the world?
So, I mean, in terms of quality of life and many other factors, today Valencia is great. And I'd say with the remote work life, with the remote workforce, your team can be anywhere, and that's great. So it doesn't really make a difference where you are. It does make a difference when you're trying to sell into the U.S. healthcare ecosystem, because what you realize is that not because you're in Valencia, but because you're not from the U.S. healthcare ecosystem, you don't have the keys to many of the doors you want to open. So you really have to put in a lot more effort. You really have to the first job is to like be an active member of the community there. And that requires a lot of work. So I would say it's not just about the location. It's about where you are. It's about who you are or where you've been before, right? So trying to be a disruptor in the healthcare ecosystem of the US, it's very complicated if you have not previously been in the US in the healthcare ecosystem. But at the same time, what I see is that people that come from the US healthcare ecosystem are super biased towards doing marginal improvements of what already is happening over there. So there's some clearly some things that are in favor if you're part of the network, because it's very endogenous. So you really have the access to open different doors, but at the same time, you're very conditioned to what can be done. And it's very complicated for many people to be like thinking outside of the box. I am completely outside of the box, trying to get into the box. So the challenges are different. Yeah.
Yeah. Yeah. About the challenges, I mean, because maybe to the audience should be great to know the answer of the next question. That to me is what was the biggest mistake you made with your company so far?
Oof, I can tell you, yeah. So we are a medical company and a clinical company, and I think from my background, I've decided that I can only get the product like properly in the face of an insurance or in a hospital group when I have all my clinical data. So I've been like sort of like working we started in Spain, B2C, gathering data for users, testing everything, getting everything right, so that the day we were going to like announce the public in the US, we had everything in place. And what I figure out is that in the US, it happens the other way around. You start selling, and if someone likes it, you start doing the clinical data afterwards. So what I'd say is that if I was to start today, I would start looking for my first contract before building the product. Not because I have not built the product properly, but because the sales cycle is like 2-3 years. And you really need to understand, you need to put a lot of effort into like being part of that network. And nobody there, like the people that are getting their first contract are not working first on their data and then on their sales process. They're doing it the other way around. So you figure out some people that are already opening the doors because they started 2 years ago. Even their product, they've just started the product like a couple of months ago, but their sales cycle was started 2 years ago. And so by the time they have their product, they already have their contract working. And so it suddenly starts working. So I'd say that, especially regarding to the US, don't be afraid of like sales, like start selling from day one, start participating actively in the network. And don't think that you need to have the perfect product with the perfect data to be able to like speak out loud. Because some facts, especially in the area where I'm working, some of you can leverage fast publications for the clinical background. You don't need to gather your data absolutely by yourself with your own service. You should be just like figuring out who's going to pay for what do they care, and how to start getting in contact with that person.
Good. Well, to be honest, while you were answering, I have a few questions in my mind. A few of them that I wrote them, but a few of them are new. But I'm gonna go with, because you were talking about 3 years ago, 2 years after. So how do you see your company in 2030?
Oh, by 2030, we're definitely, well, I mean, 2030, we're in 2023. So I can put that a little bit faster, right? 2030 for a startup, it's too much. 2025, we're integrated into Medicare, which is the main insurance company, the healthcare system in the US, and it's the healthcare system that pays for senior health. So our services are integrated inside of Medicare. We're offering products for fitness for seniors, for chronic health, chronic pain rehabilitation, and possibly gathering a lot of data for value-based analysis, trying to prove that having an integral plan is not only helping in the chronic musculoskeletal area, falling risk, the reducing the risk of falling, but also has an impact in cardiovascular health, diabetes, metabolic syndrome, cognitive health, and by then being able to work with the top providers that are actually starting to move towards value-based healthcare. So that's what we see 2025, right? 2030, there's so many potential strategies that for me, it's easier to almost say 2040, right? Everyone in 2040 needs to have a longevity coach. People are not going to be aging, leaving their aging process to Mother Nature. Everyone is going to have a strategy, and they're going to have a personalized set of goals that are going to be combined with diagnosis that are not going to be only the traditional healthcare blood tests that you get like every 6 months, but are also going to be combined with a lot of the biometrics analysis that are being designed through the different wide set of wearables and whatever can come up in the next 10, 20 years. And they are going to be tracking continuously the evolution of their health in different parameters, and that's going to be combined, that's going to be extrapolated to health span, to lifespan, and combined with a wide range of different treatments from the longevity field. So I guess that everyone is going to have access to this longevity plan that is going to be included and co-paid by their healthcare system, and then possibly different insurance policies will be covering different parts of longevity optimization strategies.
Nowadays, after 2 rounds, what is the percentage of the company you have? Because it could be interesting when people are trying to get money from VCs or whoever. And based on that, what is your current stage and what will you look for in the?
Okay, so first of all, when talking about money, everyone must have their own strategy because it really depends on the perspective of their market size, the potential of growth, the potential of how big the problem is. So I think that everyone has to take that information individually, and it's not like a range where you can just like put yourself compared to the average startup, right? So we did a seed round, a pre-seed and a seed round. And also must be noted that I co-founded the project with my husband, so which was a second time co-founder. So we had a lot of like expertise on like raising rounds and how we should be like leveraging our own interest. And also when we talk about percentage of how we have, it's combined. So we actually have today around 75%, but it's combining us together, right? So I think it really depends on your own strategies. I couldn't give like generic messages to everyone because we didn't want to compare them to ourselves. And at the same time, I have the experience of what I did for my company and what I investigated. So I am not an expert in like the startup ecosystem, and the only thing I know is that I have one data point, right? My only piece of advice would be that be sure you negotiate a lot for yourselves. So I see a lot of startups that they give a huge percentage at the beginning for a very low amount of money. So that is just going to condition yourself for for the rest of your startup life. Our goal is to be able to reach a Series A with 50%, over 50% of the equity, but that's our strategy, right? It really depends on what you want as a startup, and what you should definitely not be giving is like 20% for like 100,000 euros or something like that. And I've seen that like 1,000 times. So I think that especially in healthcare, there's a lot of people that come from like scientific university background. They have little expertise from the startup ecosystem, and I think they need to learn that. I wouldn't say that they need to have a co-founder that has a startup background. I think it's the co-founders need to learn about the startup ecosystem, and they need to go to like they need to read, follow blog podcast, obviously, blog posts, tweeters. They need to be like really aware of what's happening, and it's something that I've seen thousands of people not paying a lot of attention into, and I would say a lot of like female startups too. Like they just like, I don't know how to raise. Well, you need to educate yourself a lot. You need to educate because whatever decisions you make are going to have a huge impact in the future, and you're just like cutting yourself from like growing in and getting funding. So also in being inside of the EIT healthcare ecosystem, I'd say like look out for a lot of like different European subsidies. There's a lot of grants, especially in the healthcare ecosystem, in the healthcare area. Make sure that you take advantage of those grants and you really like leverage the fact that they're not equity related, because that's going to help you. So yeah, and how much to raise, that really depends on you. What do you need to do? Like raise as little as you need or raise as much as you can, right? For the lowest amount of equity. So it's just a negotiation. Just like definitely don't settle for like the first situation. Oh, and one last thing. You have to meet hundreds of VCs to get the right ones. It's not like you meet, I have spoken to many startups and they're like, I spoke with 5 and 5 said no. Like I clearly don't have any opportunity here. Like you need, at least in Europe, you need to meet, I don't know, 50 to be able to make the right choice, because at the end of the day, it's you the one that's choosing. And also be aware that you're not gonna like everyone. You only need to like a couple to be able to like work forward. That's in Spain. That's in Europe. Going back to like the differences between Valencia, living from Valencia and the US, I'd say that most of my friends in the US closed their rounds in like 2 months, a month. And so the other day was having a dinner with a friend, and I was like, "So are you raising?" And it was January, and she was like, "No, I have money until April." It's like, what? You're not raising, and you only have funding until April? It's like, come on, I'll start by the end of March, right? And it's like, wow. And then she only expected to leave herself 1 month without really like not having funding to like pay her employees. And the other day I spoke to her like 3 weeks after that, and she was like, "Oh yeah. I closed my round. Yeah. You had not started 2 weeks ago." So it's just like, if you really have a great project in the US, there's a lot of money. That's like would be my main differentiation. I have not heard anyone that has raised 10 million in 2 weeks without being a unicorn. She's in the lab. She doesn't even have like a product, like a market strategy yet. She's just like doing biotech thing, and it went. So yeah, there's differences. Yeah.
Impressive, Clara. Thanks for your answer and for being as open as you were. And the thing is that I have 2 questions regarding your last answer. One of them is how is it being husband and wife at home and co-founders of the company? That's the first one. And the second one, it is like regarding, you talk about grants. We know EIT Health has also acceleration programs. What was, in case you had one, what was the best acceleration program or you were involved, or the grant you got from whatever? And also the question about you and your husband, being wife and husband in your home, and
Okay.
founders in the company. Take the first you.
So founding with your husband is as good as your husband's choices have been. So it's like everything in life. So you already co-founded a startup with your husband and you were not aware. You didn't sign for like a bunch of statutes like you did for like your startup, but you already did. So in my case, that was the best decision I made in my life. And finding my husband and founding a startup with him has been just as easy as it's been like founding the rest of our life. But again, It really is to like the extent to which you have valued all the skill sets of the person you're meeting. So sometimes when they ask me like, what is the most important thing as a female startup, most important recommendation you would give another female startup, I always say like make sure that you're surrounded, especially at home, especially by your husband, with your biggest fan, and you're the person that most trusts on your capacity, that most supports all your energy and your drive and your goals. And if you're able to do that, then why not co-found a startup with him if he's the most intelligent and person with if he's the person with the biggest connection you have. So in my case, it's been super easy, and it's been super helpful and super fun. Like I love my project, I love my life, and I love being able to share with my husband or my co-founder 99% of it. Also, when people think about co-founding with someone, they think like you're sort of like hand in hand every single day, like typing in the computer next to it. It's completely different. Like, I mean, it also has to do with like how you manage your life and how you manage your startup. In my case, my co-founder has a wide set of different skills compared to mine. And what we have in common is that the general vision, the trust in the other person. We're just supporting each other, giving each other ideas, and helping in like move forward in that plan. But we leave parallel areas of the companies, so we're not like day to day like sitting together and like chair next to the chair like writing together the same presentation. It's not the type of thing and it's not the type of co-founder you should be finding either. So you should be finding someone that has a very wide different set of complementary skills, but at the same time that vibes on the same way you do, so that you have the same sort of like attitudes, the same sort of like perspective, drive, ambition level. And it's just that you have different complementary skills, so you can actually like do different things inside of the company. And I think that also ties back to the type of co-founder. I also get a lot of questions asked about how do you choose a co-founder. And in my case, again, it was my husband, was that easy. But I think it's very important to be very similar, very different in the set of skills you guys have, but very similar in the way you guys vibrate, because you need to be on the same wavelength. Otherwise, you're going to be counterproductive. You need to have the same risk desire, or the same level of ambition, the same way of making decisions or choosing speed. I think there's many areas that you could be analyzing, but it's got to be someone that when you sit together, you can't stop talking about. Like you are creative, you're moving things forward. It's someone that you are talking about the top 5 percentile of things, that you don't have to explain the other 95 percentile because you're already in the same spot. If it's someone if you're trying to choose your co-founder and you figure the other person, you're trying to explain things, or you're trying to explain why you're thinking this way, then it's not going to be a productive. It's not, you guys need to be creative, and to be able to be creative, you need to be able to understand each other completely. You're bringing different ideas because you have different perspectives, but the thought process is running at the same speed. Otherwise, like, you're not going to be moving fast. So in that sense, that happened since the beginning with my husband. That's why he's my husband. And when deciding who to make how we were going to found, or who I was going to found the project, or who he was going to found his next startup, it was just like, no question. Like, we were going to be co-founders. There was no way. Like, we were going to be participating in the next thing together. So I don't know if you have any question about that, or you want me to jump into like the grant.
No, I mean, it was, I mean, I wanted to know, just the other question was regarding what was your, I wanted to ask you what was, because we are running the last minutes of the interview, and I mean, I have I'm gonna launch you a few questions, and you can take the ones you like, because the thing is that one of the things I would like to have in this podcast is like an open space, and to you guys as co-founders, in order to launch the message to the audience you want to launch. So my question was regarding that. What was your biggest help when you were launching the company? I mean, in terms of could be an acceleration program like the IT Hub acceleration program has, or any other. It could be a grant that you got from, I don't know, maybe a government, maybe your city hall or whatever. And also, this this is one question. Another question I have been thinking about was that if you, even if you are younger to use your app, your Rosita Longevity app, have you started using it? Because this is a question I got from the very beginning, because at the end you want to test your product, but you are not able to start using it.
The Longevity Coach app or the Longevity Coach plan is a plan that can be started at any moment of your life. The plan integrates so it actually starts depending on what your current problems are. And if you don't have any problems, then you just skip that phase. So you can start at any moment of your life. I do a lot of biohacking tips for myself, and I do everything that's inside the Rosita app. And I don't think that you need to be the age of the target population to develop a product. I actually think that one of the problems that we have today is that we only design products for things that we use. And there's a huge percentage of the population that is not in the phase of creating a startup or solving a problem because they are already retired or less into technology. And technology is a mean that we actually need to solve their problem. So I think that's a huge it's very important to have in your mind. What I do have access is to thousands of seniors in the longevity school, testing them and seeing what works, what doesn't work in terms of UX, in terms of problems, in terms of general questions. And I have designed the product for users, designed with the user in mind. So that's completely in the core base of the strategy. Parallel to that, I do like most of the biohacking things that we propose ourselves. A lot of what has to do with chronic pathologies, I don't do because I don't need right now. But everything that has to do with like nutrition, exercise, cognitive health stimulation, I could actually send you like, if I was just like, I'm in my house, so I could just like bring you like the bunch of like supplements that I'm taking right now, which I think are like super cool. That would be like another podcast, right? Biohacking. Also having to add that there's there is almost no information on how to biohack a female that is on their peak of fertility right now or whatever, because I've just had 2 kids in the last 3 years, and there's no biohacking information about like what you should be doing in that moment of your life. And it's a very important field. So if everyone's hearing us and wants an idea would be like to create a startup and like to optimize your health as a pregnant woman, pregnant or breastfeeding. So leaving that aside, let's go into like the acceleration area. I've participated in a couple of programs, and I think that the most important thing that has helped me is actually my co-founder and myself being second-time founders. So already having the experience. I think it's very valuable in terms of finding a co-founder or like thinking, visualizing what's needed or not. The experience of of success and failures from the back. So having someone next to you, either a co-founder or if not a mentor, that has already gone through a lot of the process and that can give you a lot of the insights is essential. If I had to choose an accelerator program right now, I would choose one that opens me a pilot test. So I would be very wary of the ones that only provide you with information and education. And I would really want someone that is contacting me with a pilot, so that the end goal of the program is to match you with a pilot, and that the whole process is making you pilotable. Because one of the things that I am very afraid or conscious about grants and innovation is that they help you design your product better, but no one is helping you put the product into the marketplace. So I have a lot of subsidies related to innovation, healthcare, blah, blah. What I actually want is the government to have funding to hire me, or like the government to integrate myself into a pilot test. And when I go and open those conversations, most of the time they love my product and they just have no way to hire or to work with a startup. So if I was hearing this from EIT Health or from any other healthcare European institution, I would say get contracts with hospital groups, with healthcare groups, with insurances, and instead of providing funding or instead of providing education about marketing or about like how to design a product, why don't do an accelerator program in collaboration with the partner that actually needs that product? Why don't you open the keys to actually being able to like test the product, gather data in the context of a customer that could be replicable? So that's been like my biggest, not mistake, but that's very lacking in the general terms. So I've participated in many accelerator programs, which have been great to meet other startups, to meet mentors, to meet teachers. But at the end of the day, if you're second-time founder, most of the information you already have, and what you actually need is the contact into like the healthcare ecosystem and actually be able to like pilot your product to where it's needed, or figure out that that specific solution is not needed, but this minor pivoting is actually very useful in certain areas.
Well, Clara, thank you. I mean, thank you for your time. Thank you for being here. Thank you for everything, because to be honest, this is the kind of interviews I would like to listen to. And to be honest, I've been the guest of this conversation, but I'm looking forward to being the listener, in order to listen to you, what you told to the audience. So to me, first of all, thank you to Clara and all the people from EIT Health Innovation Community who has helping me to build this very first episode. And Clara, just thanks a lot for being so open, for answering my questions, for everything you gave us. And now to me, it's time to say see you in the next chapter. But if you want to close with whatever message you would like to tell to the audience, it's your time. So thanks a lot, Clara. Looking forward to the next.
Thank you, Gonzalo, for giving me the opportunity to like speak to the audience. And whoever wants to follow me, they can find me in LinkedIn and we can speak through there. And also, if anyone knows a hospital group or an insurance group in Europe that wants to start a pilot regarding reducing the risk of falling, reducing chronic pain in seniors, or increasing all the areas of functional and metabolic health, you can send me through LinkedIn, because we're looking for like pilots. And if not, you can also help us by checking our website, Rx-Longevty.com, Rx/longevity.com, and checking our product for possibly your parents. So I'd love to hear more from you. Thank you.
Thank you and goodbye.
Bye.
Visit community.eithealth.eu to join our community and shape the healthcare landscape with us. For more such videos, subscribe to our channel.